Hey everybody, I'm JJ, you're watching Reality Survival, and today we're going to talk about everything that you need to know about radiation sickness. Some people, it's got many different names: acute radiation syndrome, acute radiation sickness, radiation poisoning, lots of different titles. You call it by, but essentially what happens when you get exposed to too much radiation? What does your body go through and all that kind of stuff? Now, I'm not a medical professional, but I can read. And I got all this information that I'm getting ready to talk to you guys about from the Mayo, and all these links will be in the Substack thread that will go out with this video. So if you're subscribed over at Substack, which is realitysurvival.substack.com, then you will have these links. Mayo Clinic, healthline.com, cdc.gov, verywellhealth.com, mountsinai.org, and the clevelandclinic.org is where all this kind of came from in an aggregate sort of way. I really tried to distill it down to the most important things for you to know, because everybody's worried about nuclear war and nuclear fallout and what happens if you get exposed to it and, all that kind of stuff. So that's what we're talking about. So acute radiation sickness. The number one thing that you want to do is get away from the source of the radiation. All right, that's step number one. If you don't get away from the radiation, it's just going to keep getting worse and worse and worse. Radiation it has an accumulative effect. It's cumulative over time, and so if you stay in it, you stay around it, or whatever, it's just going to make it worse and worse and worse. Okay. All right. Number two is decontaminate. Once you're out of the source, away from the source of the radiation, you have gotten some time, distance, and shielding, right? Those are the three things we've talked about in several videos. You've gotten some shielding, you're in a safe place, or at least a safer place where you're not getting as much exposure. Then you're going to remove all your clothing, put those in a sealed container, and kind of remove those from your safe area, right? You want to wash the body, or the patient's body. If it's yours, wash your own. If you're too sick, or if it's a patient that you're dealing with, then you're going to want to wash their body vigorously with soap and water, and then wash their hair as well with shampoo, just like a baby shampoo or something real basic. You don't want to use any conditioner or anything like that. Obviously, that's not good. You're not setting them up for a styling appointment or anything. And then just cover them, with a blanket or a sheet or something like that, while they're on the gurney if they're really sick. So here's the thing. You're going to need to treat the symptoms. So let's first talk about what those symptoms are. That's going to be weakness, fatigue, fainting, confusion, and any range of these things. Bleeding from the nose, mouth, gums, or rectum. Bruising, skin burns, open sores on the skin, sloughing of skin, dehydration, diarrhea, bloody stool, fever, hair loss, inflammation of exposed areas, redness, tenderness, swelling, and bleeding, nausea and vomiting, including vomiting of blood. And then a different way to describe it from burns is ulcers on the skin or sores in the mouth, the esophagus, the food, your food pipe, stomach, or intestines internally, which you wouldn't be able to see necessarily. Okay, now, as far as treating those symptoms, there's some over-the-counter medicines that you can use that might be, given to help reduce the nausea, vomiting, and pain. Tums and Gaviscon are two good chelating agents anyway, so that would be a good thing to keep around. But essentially, you're just going to try to make the patient comfortable as possible. So you can give them, aspirin for, fever reduction, or acetaminophen for fever reduction. You can give them, something to keep them from vomiting, help them with diarrhea, whatever. You just want to try to make them comfortable. There's not a whole lot that you're going to be able to do to treat it in any real significant way unless you get them to a higher level medical facility. And even then, the options are still quite limited. And these articles that I have in here talk a little bit about some of those options for a medical facility, but I don't think it really bears going into here because most of us aren't doctors, right? So you can give them some over-the-counter stuff to treat, their symptoms as needed. Number 5 is antibiotics. You can give them antibiotics to prevent and fight infections of those blisters and ulcers and stuff on their skin. Jace Medical is a great resource for that. You can go to jacemedical.com/reality survival and use a discount code, what is it? Reality 10, I think, and Reality 10. Now I'll put it on the screen here, but that will save you $10 off of a 5-pack of prescription medications. Now those medications are used for a wide spectrum of different things that could happen in a kind of a SHTF kind of situation, or some extended situation where you might not have access to medical care, right? And a nuclear war could definitely qualify there. These are prescription meds that are given out from a pharmacy in I think it's Salt Lake or somewhere in Utah by an actual doctor and all that. It's essentially a telemedicine kind of deal. You go online, you put in your information, and then they can send you the stuff, right? It's pretty basic. But it's 5 different good types of antibiotics that can help keep you from getting infection from your burns and ulcers and all that kind of stuff that would happen in radiation poisoning. The reason that your body is even more susceptible is because the radiation starts to have an effect on your bone marrow, and it starts to lower your white blood cell count. And so your body becomes more susceptible to infection, through burns and stuff like that, if you get a pretty significant dosage of it. Okay, so you want to make sure that treat the skin blisters and ulcers just as regular burns. Keep them covered so they don't get infected. And this is where I would recommend having a Refuge Medical wound care bucket. A bucket that is going to enable you to treat a large degree of wounds and to keep wounds covered and clean. You don't want to put any ointment or anything like that on radiation burns. You just want to use dry, clean dressings. And the Refuge Medical Wound Care Bucket is a great product to be able to do that. If you use discount code Reality Survival, it'll save you 10% site-wide, I think. So check them out at refugemedical.com. But you've got to be able, if you're seriously worried about these things, you really do have to have the ability to do long-term care. And that's what those wound buckets do. It's basically designed to treat a major wound for 30 days straight. Because every day you got to put new dressings on and off, and then you keep changing it. So it's you got to have a lot of medical supplies, bandages when it comes to that. Okay, if the exposure was less than 24 hours ago, you can give them potassium iodide or other chelating agents and antioxidants. So this is just going to be just a real quick talk about some of the things that you could stock up from over-the-counter kind of sources that can help as a chelating agent. And basically what that is that's something that is going to help your body pull the radiation out faster. It's going to help or keep it from being absorbed. Okay, it would be like a layman's kind of way to think about it. And then antioxidants can also help in this. So if you're wanting to stock up over-the-counter medications or items that can also block the absorption of radioactive isotopes, you should get iosat tablets, like potassium iodide, whatever. There's also Thyrosafe, iosat, either way. Tums, Gaviscon, baking soda, apple pectin, melatonin, vitamin C, or a good soluble multivitamin and plenty of water. I've heard some people say seaweed in the comments, but I have not been able to verify any credible source for that, so I don't really know if that is the case or not. I understand they contain some iodine, but I'm not sure if it's exactly the same as what the potassium iodide tablets are. Could be, I haven't been able to find anything. So those items that I listed off are going to, they all kind of target, because different radioisotopes target different areas and types of the body, and so having kind of a full spectrum of these, if you can give it to them obviously before a nuclear bomb goes off, that is best. But if it's within 24 hours, then it could still potentially be helpful, is what this information said. Okay, you want to keep them hydrated as much as possible. You want them to urinate somewhat frequently if possible, and that's difficult to do with sick people sometimes, but passing urine is a primary way to excrete the radioisotopes. So keeping them hydrated helps. If possible, you want to get them to a medical professional. If not possible, keep them comfortable and treat the symptoms as we talked about. You do want to keep notes. This is important. You do want to keep notes on the time from the exposure to the onset of the symptoms as they develop. So, basically from the time he was exposed until the time he started vomiting was this amount. From the time he was exposed until his fever, hit 102 was this long, or whatever, just keep some notes on kind of the situation as it develops and as you start to see the symptoms, because that can help the doctors understand if their dose is survivable, and this becomes really, really important in a mass casualty event where patients are being triaged. If they have more information, they can make a better assessment of their likelihood to live or not live, and then the patient could potentially be triaged into a better situation, or instead of being set aside and saying sorry, you're not gonna survive. So think about that and keep those notes if possible. Symptoms may appear at first, and then they could get better, and then they could reappear days or weeks later. So if it was a situation where you had some symptoms and you weren't really, really bad off or whatever, and then they got better and you think, oh, good, I'm good to go, well, it's possible they could come back again. So with radiation poisoning specifically, we see that where they'll present, kind of go away, and then they present again. So think about that. Ultimately, the severity of the exposure is going to determine whether or not they live or die. If a person vomits less than an hour after being exposed to radiation, that usually means the radiation dose received is very high, and then death is probably going to follow. Okay. Note, children and unborn babies are the highest level of risk. So when it comes to keeping your kids safe, don't let them go outside and play in the fallout. No, but some people could maybe think that younger kids are their bodies will metabolize it better or faster or something along those lines, and that's not true. They can't, and they are actually more susceptible to it. So you would want to keep your kids and your babies in the best places in the shelter as possible with the most protection. Okay. And then just a quick note on that too, Mira Safety does offer some child-sized gas masks, as well as NBC rated chambers for a baby, like it's a little chamber that has a filter and stuff, and you can put the baby in there. And then of course they've got adult gas masks and stuff like that as well. So you can check out Mira Safety. They're an affiliate link down below. All right, so here's some quick do-nots, things you don't want to do. You don't want to remain in the area where the exposure occurred. You do not want to apply ointment to the burned areas. Use clean, dry bandages. You do not want to remain in contaminated clothing, and you do not want to hesitate to seek medical treatment unless you're still having to shelter. It's a really good idea if fallout has just fallen that you really don't go out in that fallout for a minimum like a couple days if you can. Now, if you can't and you make a decision that you have to go, then at least wait a couple hours. But you really should try to wait 2 days or longer. 2 weeks would be preferable, but obviously if someone that's important to you is going to die, you might try to risk it. You got to do what you got to do. Just understand that you're putting yourself at risk if you do that. 2 weeks is optimum. Okay, some of the older data on how much radiation you can get says 200 roentgens of total exposure is sort of like the 50-50 point. Some of the newer data is now saying 400 roentgens could be survivable by half the patients. So I don't know which. Maybe you can kind of split the difference and say 300. Somebody was saying that in the comments the other day. So I went and kind of looked it up, and there is a disparity between the two. Some of the older stuff says 200. Some of the newer stuff says 400. So it's hard to say, and it probably depends on how fast you get to medical care and all that kind of stuff as well. Now, having dosimeters and a radiological survey meter would be a very good idea. Geiger counters are useful to make sure that clothes are not contaminated or food is not contaminated, but a Geiger counter is very, very sensitive. If you take a Geiger counter outside, like shortly after there's fallout or something along those lines, it ain't going to work at all probably. And and basically it'll essentially zero the meter out to where you think, oh, there's no radiation out here. Well, that ain't the case. There's too much radiation and the Geiger counter can't even work. So you really would rather have a radiological survey meter. And unfortunately, there are not a lot of those, not a lot of good ones on the market out there that are reasonably priced and easily accessible. So that is what it is. Anyway, guys, this is kind of just the down and dirty information about radiation sickness. I have a longer video where I talked about the chelating agents and the things that you can take beforehand to keep from feeling the effects as much of radiation poisoning. You can go check that out, or I'll try to link it here in the description below too. But here's something to think about. If a nuclear bomb goes off in an area that you live, you will get radiation exposure. Okay, you're going to have some degree of radiation exposure, and it is very survivable. It isn't something that movies make it look a lot worse than it is a lot of times. And it's not that it's not good. It's just that if you use some common sense and you understand the nature of fallout and the fact that it decays very quickly, and you shelter in place using the time, distance, and shielding that we've talked about many times, then you can make it through, all right? And some exposure isn't necessarily going to be fatal. It's the high degree of exposure when the fallout is really new and hasn't, kind of burned off yet, that's really going to get you in trouble. So having plans to be able to shelter in place quickly is a very good idea. Okay, you don't want to be out in a vehicle. A vehicle offers almost zero protection from fallout. You really want to be inside of a building with a good basement or very thick concrete walls, something along those lines. Go back and check the playlists that I've done. I made up another playlist today. So there's plenty of information on the channel here to check out about what you want your fallout shelter to look like and all that kind of stuff. But if you have a plan, it's totally survivable. You can get through it. One of the ways that could help you get home before the fallout starts to fall is by having an EMP shield on your vehicle. Now, EMP shield is a device that basically hooks to your battery and then to your chassis, to the ground of your vehicle. And if your vehicle is hit with an electromagnetic pulse from a nuclear weapon, a detonation that happened nearby, or a high altitude nuclear detonation, then it essentially monitors the system, the whole system, and it shunts off any over voltage that is induced into the system to the chassis over and over again, billions of times per second, literally, and it keeps your circuitry from frying. It just bleeds off in a very fast manner the induced voltage into your system, and so that way your car will still be able to run. So if something happens and you're out and about, fallout is going to start in the immediate area around where the detonation happens. The fallout is going to start coming down at probably around 10 to 15 minutes or so, something like that. And then downwind in the plume, it'll be, you know, significantly slower, but definitely, you know, within an hour or so for sure. So you have a short window of time to try to get someplace if possible. Now, will the roadways be jammed? Sure. Is it possible to try to get parallel roads and get off of the main highways and all that kind of stuff? Absolutely. And is that going to be faster than walking? 100%. So that's why I think it's a good idea to have these. They are tested by Keystone Compliance Labs, and they meet the military specs for EMP hardening. So I think that's impressive, and that's the only reason I recommend them. If you use the discount code Reality Survival, you can get $50 off per unit. So that can save you quite a bit if you got a couple of cars or whatever you want to use. I'm getting ready to put one of mine on my tractor, my ATV and stuff too. So anyway, that is that. I hope it was useful information. Again, if you're signed up on Substack, then you will have the links to this, and the giveaway announcement will be coming out tonight. So you better get over there and get signed up. realitysurvival.substack.com. All right, guys, take care. We'll see you in another video here shortly.